So this is a bit of an unusual segment. I haven't done too much in terms of health, but we're going to call this Crowdsource the Tooth. And I'm here with my dentist, Dr. Yokoyama. Dr. Yo, it's great to see you.
Hey, Jason. Glad to be with you.
Yeah, I've been a patient for, I think, about 5 or 6 years, and I first found Dr. Yokoyama when I was living in Los Angeles, and a friend of mine had been diagnosed with pancreatic cancer at the age of 41. And so I started he died 2 years later, and I started becoming really focused on, like, why are so many people getting cancer? There's so many things that happen that doctors don't know what causes it, don't know what things like mercury and toxic elements in the environment might do to us. So I found Dr. Yokoyama's practice, Dental Healing, right? That's the name of the practice. And I was immediately attracted to your approach to dentistry because you're a holistic dentist and you focus on biocompatible. Well, why don't you tell everyone what the focus of the practice is, Doctor?
Well, we're a more holistic practice. That means we have a philosophy that encompasses the philosophy, the thought that the mouth is connected to the body. So whatever happens in the mouth does affect the body, and what happens in the body affects what we do in the mouth.
Right.
So we are basically thinking in a different way about the dentistry that we do.
Right.
We do general dentistry. We do the things that normal dentists do, but we approach it in a way that makes the work that we do in the mouth compatible with the rest of the biosystem. Mm-hmm. So our job is to make sure that whatever we do in the mouth doesn't conflict, cause problems, or bring about more problems for the body.
The overall health.
Yeah.
Now, when I first came to you, Doctor, I had, I think, a total of 7 dental amalgam fillings that I had since I was a little kid, so 20, 30 years in my mouth. And you know, most people think of these as silver fillings, but they're not really, are they?
No. Well,
What's
as you know,
dental
yeah,
amalgam?
as you know, dental amalgam is a mixture of mercury, silver, copper, different metals alloyed together to make a solid metal filling that goes in your mouth.
Right.
So, of course, everybody knows that mercury is a toxic material.
Yeah, it's the most toxic non-radioactive material known to man, isn't it?
Well, I'm not sure of that statement, but it is very toxic. When you have a mercury spill in a hospital from a thermometer or something, you have to evacuate. They bring in the hazmat team. I mean, it's very serious.
Yeah.
So if we don't want or don't need to have mercury in our teeth,
why put it there?
Then we're better off not having it there. If we have a good substitute, if we have something else that we can put in there.
And what sort of materials are you using as an alternative to mercury?
So our specialty here is porcelain. We use a high-grade porcelain to replace silver fillings. There also is a plastic filling, composite material that can be used to replace a mercury filling.
And a lot of people, I think, are worried about, you know, BPA and some of the toxic materials in plastics, but once it's in the mouth, it's a lot more stable than mercury, right? I mean, mercury is a liquid, obviously, at room temperature, so at 98.6 degrees in your mouth, or even hotter when you're drinking coffee or whatever, the mercury in the fillings is actually evaporating in your mouth and being absorbed into your body, isn't it?
Well, it doesn't happen to have anything to do with the degree, the actual temperature. But we know that metal, mercury fillings do off-gas, and mercury does come off of the fillings. Mm-hmm. And of course, as they are worn down, mercury gets into your system. Mm-hmm. And our job is to consider what a mercury filling will do over the lifetime of the filling.
And the patient.
And the patient. So over a period of time, if there's enough mercury that accumulates in the body, that can be very detrimental.
Yeah.
So our thought or our philosophy is, if you don't have to have the mercury in there, and there is a good substitute, then we give you a choice. Do you want to have a mercury filling, or would you like to have porcelain or composite material?
Yeah, and you know, doctor, having these dental fillings removed by you and replaced with porcelain in some cases and composite resin for most of them was really the start in my personal detoxification. I've got involved in a lot of other things to detox, and in the course of doing that, I lost like 25 pounds. I lost 4 inches off of my waist. I feel much better. My teeth look much better. I used to look like a cowboy. I had like all kinds of metal spots and everything. I mean, it's crazy to think that for hundreds of years, dental technology, I mean, when did they start using mercury amalgam fillings in dentistry?
Yeah, I don't know exactly, but I think it does date back to the Civil War.
That's crazy.
Yeah, well, and you know, I'm glad that you mentioned all these things, but I am reluctant to say, oh, you know, Jason, we took out your mercury fillings and now all these things happen.
Right. That's my opinion. You're not saying that.
Yeah, but part of that is that you know, we've removed or we've reduced the amount of toxic load in your body.
Right.
And that can be a significant help toward the rest of the biosystem coming into balance and doing what it's supposed to do on a daily basis.
Right. I remember, you know, in part of my research before I found your practice, I saw this study that was done maybe in Sweden where they took like sheep and monkeys and stuff and drilled their teeth and put in mercury, and then within weeks they tested the organs, the pancreas, the brain, all of the organs had mercury in them from the fillings.
Right. Well, what you're talking about actually, I think, was done at Calgary in Canada.
Oh, that might be it. Yeah.
And it was a monkey study and a sheep study.
Right.
And very famous now, showing the migration of mercury that was labeled radio.
So they knew it was coming from those fillings.
It was radio labeled so that they could film it with a special camera
as it was moving around the body.
Well, after they had placed these and the monkeys or whatever were filmed at a different time, and yes, there was mercury in different parts of the body.
Right. And so, I mean, obviously, you know, your liver is working to detoxify your body from things that are in water and food and, you know, whatever we might be drinking and all that. And if you're also bombarding it with mercury, it doesn't exactly help your liver. So that's part of the holistic dentistry process. Doctor, can you speak for a minute about Weston Price, very famous dentist from back in the day?
Well, of course, Weston Price was a scientist as well as a dentist, and he did some very exquisite experiments and gathered lots of data about not only mercury fillings, but also root canals and problems with some of the processes that we do in dentistry for people in an effort to save the teeth.
He's a controversial figure, and some of the things that we're talking about are controversial, aren't they? The
Absolutely.
American Dental Association, for instance, doesn't necessarily agree with some of the things that we're saying.
That's right. The American Dental Association will tell you that the mercury fillings are safe, and they will tell you that
even though the package has a biohazard warning on it, when it's in the package, it's a biohazard. When it's on the floor, it's a biohazard. But when it's in your mouth, it's a filling.
It's a filling. That's right. That's right. And you know, the subject of root canals is a whole nother issue that if we got into, we could talk about that too.
Right. Well, and thank you very much. You've saved me from a root canal today, which is the reason why I'm here. Whenever I'm in Los Angeles,
well, you know,
I come to see Dr.
I think that is worth talking about.
Yeah,
because
let's talk about it.
You had a diagnosis before of you know, this tooth may not be savable.
Yep.
You need a root canal. And many times we can go in with the idea or concept that we would like to remove the cavity. We would get close to the nerve, but we don't want to expose the nerve,
Right.
but we want to sterilize that area, and we have some material to sterilize it, ozone, ozonated water, lasers,
Yep.
and we can seal that up, sterilize it and then seal it up, and many times the pulpitis or the irritation to the pulp is reversible. And in that case, and in your case, it was.
Yeah.
We were able to seal that up for several months, and you went about your life and came back.
Yeah.
Everything seemed to be fine. We prepped it for a porcelain covering.
Which feels great. It's in there right now.
Which is in there right now. And the porcelain seals that area really nicely, holds the tooth together, and we go on with life.
Yeah, yeah. No, I was very, very pleased with that procedure working out so well. So a lot of people find it crazy that I travel from New York to Los Angeles to see my dentist, but Dr. Yokoyama's practice has actually won awards from the state of California. Should we take a little walk around the office
Sure.
and point
Sure,
out
I'd be
some
glad
of the...
to show you.
Let's do that and see
Well,
some of the things
you know,
that have...
first of all, we are you still filming?
Yes.
We are in the operatory here, which has ambient light. So we watch the sun rise in the east and set over here in the west. And during the day, if we watch this circadian rhythm, helps us to go to sleep and sleep soundly at night, because we have experienced the day. In some offices, you don't really see the outside very well.
Yeah, that's true.
So, yeah. One other thing, we have linoleum floors as opposed to a vinyl floor. Now, linoleum, of course, is a linseed oil, organic material, and probably your grandmother had it in her kitchen or something. Now we have vinyl, which requires a totally different adhesive, and you're going to off-gas with adhesives that are much more chemical than what we have here.
Huh.
Yeah.
Interesting. So all of the building materials used to construct the office are part of the holistic approach to the practice?
They are part of the holistic approach, and they are also green. So we went through a lot of effort to make a certified green office, and we are the first certified green office by the city of Los Angeles.
Wow, that's amazing. And how many offices are there? It's a beautiful office, I have to say, Doctor.
Well, thank you.
Yeah. So are there any other features of it you'd like to show me? There was some high-tech
Sure.
stuff that you used one time,
we-
cameras and things.
Well, we've got a lot of technology here, but more importantly, the design of the office is a sustainable, green, eco-friendly, eco-conscious design. So we have floors that are bamboo in cork, floating floors. They have no adhesive, and as you walk,
Yeah,
you
you can feel it.
You can feel it moving slightly underneath.
It's very comfortable, actually.
Yeah, it's very comfortable. We have a nice long hallway here, so we have gone through a great effort to make everything as eco-friendly. And what I was saying is that the bamboo and the cork are renewable resources.
Huh.
And if we look at this floor right over here, that's reconstituted coconut shells.
Wow. Wow. That's amazing. I didn't even realize you could obtain these kind of building materials. Oh, and you've got a Dali there. I see, I knew I liked you, Dr. Yo.
Yeah. This is actually very famous.
Yeah, I've seen it before.
Yeah, this is the head of the Madonna exploding is the translation. It is the floating Madonna or whatever. But this is particularly, I'm just going to tell you, and you may not use this, but
No, we will.
this Dali is famous because in Hawaii, Gallery Hawaii, printed these, or had these printed, but the paper was signed by Dali prior to it being
yes.
printed. So back, I think this is in the 70s or something. It was very controversial.
It was a scandal
and
in the 70s and the 80s.
In fact, Gallery Hawaii lost their license in Hawaii.
Whoa.
Because they were selling these prints and knew that Dali had signed the paper before it was printed.
And you know, when Dali died, there was a fire in his home, and it is rumored that his assistants actually killed him, and that they had him sign a bunch of canvases, and then they did these type of lithographic processes, and the idea was kill Dali, and then the paintings are worth more.
Wow.
Yeah, people in the crowdsource community can look into that a bit more.
Yeah, actually, you know, just for your
wow.
This is something that I had at the time, but it tells a little bit about the
Cosmic Madonna.
Cosmic Madonna.
Very nice.
Yeah.
So, anything else in the office you'd like to share with us, Doctor?
Well, there's a lot of things. One of the things that we're very proud of is we did receive the Cool California Award. So Cool California meaning energy efficiency. And our compressor and our vacuum system are unique in the fact that the vacuum system is a water-free vacuum system, saving up to 480 gallons of drinking water a day.
Wow.
With an operation like this with 2 doctors and 2 hygienists working.
Right.
So,
unlike my dentist of, you know, back in the day, you don't have a little mini mouth rinsing bowl that's constantly spinning water. You're using water very sparingly.
Yes, that's very true. And here in California, of course, we're asking to be drought conscious.
Sure. And then when you do the mercury removal, it's important that people know that if they make the foolish decision of choosing a dentist other than Dr. Yokoyama to remove their dental amalgam fillings, they've got to be very careful, because the removal of the fillings vaporizes the mercury and can actually give you a very high level of mercury exposure. So when you did my removals, I remember you were wearing like a spacesuit, and I had all kinds of like stuff in my mouth to prevent me from, and oxygen thing and everything. Talk about that a little bit.
Okay, that's right. We are a SMART certified and accredited by the International Academy of Oral Medicine and Toxicology. So we are very careful to do the exact protocol that keeps the patient from being exposed as much as possible to the vapor as the mercury fillings are coming out.
Right.
Yeah. So
and yourself as well. A lot of dentists suffer from cancers and and suicide is a big problem among dentists, isn't it?
Yeah, suicide was a big problem. They were the highest profession.
Do you think it's less of a problem now because more dentists are just using more modern materials? Aside from removing mercury, perhaps I think people who are young and getting fillings now are more often getting composite resin than amalgam, although some dentists still do use it. It seems like handling the amalgam so much might have been a health risk to the dentists themselves.
I think that's certainly true. However, I don't know why. You know, I don't have statistics to tell you. You know, are dentists healthier now than before?
And I like asking doctors questions like that, because you get a doctor, a lawyer, an engineer, you can't nail them down with an answer. The outcomes are unknown sometimes.
Okay, so here's our microscope.
Yes.
Which is used in our periodontal evaluation, and you can see that the microscope has a camera, and we put a sample of the plaque taken from the mouth, and we can see the little bacteria floating around, and that's always an eye-opener for patients.
Yeah, you see it right there on that TV.
Yeah, you can see it right there on the big screen.
It's funny to think about all the crazy things that are living in your mouth, but
right.
You see them there on the...
And I think it's really important, because it gives the patient an idea of some of the reasons why we would use like a laser to reduce the amount of bacteria in the mouth. Maybe we will use ozonated water or ozone to lower the amount of anaerobic bacteria. So when you see it on the screen, you really want to get in there and do something about it.
Right, it's true. It
It's
does motivate the patient.
Motivating, yes.
It is to
Right.
really see it. I mean, you know, that kind of thing is always such a mystery, whatever kind of doctor you're going to. So, I don't know, I got to tell you, Dr. Yokoyama, whenever I come to see you, I feel like I'm coming to see a friend. Most people hate going to the dentist, but I'm always excited to come and see you. And my teeth are doing great, better
Yes.
than ever. How can people find you on the internet, Dr. Yo?
We are dentalhealing.com, and I think that's the website.
Yeah.
So, yeah.
And then also people can see you at the House of Blues, right? When's that? When's that coming up?
We're at the House of Blues with Peace, Love, and Understanding. That's my band. June 29th at the Anaheim Disneyland House of Blues.
That's going to be a great gig for you.
Yeah.
Dr. Yokoyama, thank you for saving my tooth today. It's wonderful to see you. Thank you for helping me get the mercury out of my body. And hopefully some people, if you're in Los Angeles, come and see Dr. Yokoyama at Dental Healing. And even if you're not, you know, my dentist in New York City, I got a scaling there one time. Like, when I moved out of Los Angeles, I was like, well, I guess I got to go back to my old dentist. Got a scaling, and it was like $1,400 or something like that. And then I happened to be in Los Angeles. I came in here, got, you know, months or years later, got another scaling, and it was so much more economical here than in New York City that actually buying a plane ticket and staying in a hotel for one night and getting the scaling done here was a better deal. So I don't know if you're going to adjust your prices or if more people are going to start flying and do dental tourism to see Dr. Yokoyama.
All right.
All right, doctor. Thank you very much.
Oh, you're welcome.
Bye-bye.
Bye-bye.